Dysautonomia is a condition that is widely overlooked, misunderstood, and poorly cared for in today's traditional medical model. As parents, we all dream of a life where our kids are happy, healthy, and thriving. But for hundreds of thousands of families today, when this perplexing condition called dysautonomia sets in, their child begins to suffer daily from debilitating issues ranging from mood disorders, gut problems, chronic pain, muscle weakness, and much more. Dysautonomia is also a significant underlying factor in things like autism, ADHD, sensory processing disorders, seizures, POTS, PANS, and PANDAS, all of which are now seen at significantly higher rates than they were just a few years ago. While traditional medicine can sometimes offer symptom relief, many parents often wonder if there is something more that can be done to help get to the true root cause and help their child achieve full recovery and optimal outcomes from dysautonomia and all of its related health challenges. In this video, we'll explain what dysautonomia is, what causes it to develop, what associated symptoms and health challenges come with it, why it's often overlooked, and how neurologically focused chiropractic care may be the missing link to restoring your child's nervous system balance through cutting-edge new techniques and clinical protocols. For 17-year-old Francesca, health struggles ruled her childhood. Plagued by seizures since she was 7, then worsening fatigue, anxiety, and eating disorders and constipation through puberty, her quality of life suffered. Despite constant medical care, doctors had no explanation why she experienced such a multitude of symptoms altogether. It often felt like we were simply treating random issues in isolation versus getting to one real root cause. That was until Francesca's mom learned about dysautonomia from a friend. One trip to a specialized chiropractor changed everything. Dysautonomia is a breakdown affecting the autonomic nervous system, the master control center managing nearly every organ and system in the body, from digestion and regulation of inflammation to breathing and blood pressure regulation. When not functioning properly, dysautonomia throws off communication between the brain and the body, manifesting in diverse symptoms that differ based on what organs it impacts. The most common symptoms, such as gut issues, anxiety, heart palpitations, and fatigue, are related to the most commonly affected systems, which are the digestive system, cardiorespiratory system, and the brain. Not only do traditional medical doctors and neurologists struggle to properly recognize and effectively treat dysautonomia, they also struggle to explain what's really causing it. Our clinical observations and research review highlight 5 main triggers of dysautonomia. Prenatal or maternal distress, such as high risk or high anxiety pregnancy, exposes the developing fetal nervous system to excessive stress hormones in utero and may lead to an underdeveloped vagus nerve and parasympathetic nervous system. Birth interventions like forceps, vacuum extraction, and C-section lead to physical injury and trauma that lead to biomechanical misalignments and subluxations in the upper neck and mid-back areas, which then negatively impact the function of the vagus nerve and parasympathetic nervous system once again. So vagus nerve injury, damage, and dysfunction are without a doubt the leading cause of dysautonomia. Altered development and missed milestones may leave the brain and nervous system underdeveloped, off track, and less resilient and adaptable later in life. Recurrent infections, ongoing gut issues, chronic inflammation, and the overuse of antibiotics and other medications throughout a child's life. Chronic sensory challenges and anxiety in kids trigger a continual response and excessive stress hormones. Over time, this cascades into a vicious cycle where the overdriven nervous system fails to regulate itself properly, called dysautonomia. Once dysautonomia sets in, the patient struggles to properly maintain homeostasis, regulate their nervous system, and adapt to even regular daily stresses and routines. While traditional medicine continues to lag behind in their understanding and proper care for dysautonomia, there's an entire network of specialists called neurologically focused chiropractors who have a deep understanding of dysautonomia and can provide a drug-free clinical approach that addresses the root cause head-on. This unique and cutting-edge approach begins first with a deep dive into the patient's case history to find out if any of those 5 perfect storm risk factors for dysautonomia have occurred. From there, We then get to the really exciting part, our Insight neurological scans and heart rate variability technology. These scans can find and detect the presence of neurological dysfunction and dysautonomia at an incredibly advanced and in-depth level, going far beyond what traditional medical testing like blood work, MRIs, or even EEGs may reveal. The most important element of these incredible scans is the HRV exam, which is the gold standard for finding dysautonomia, and then being able to track and measure positive improvements in autonomic nervous system function as the adjustments begin and care progresses. As doctors in the PX Docs network, we are trained specifically in caring for dysautonomia without drugs, and we know how to use specialized techniques and clinical protocols that seek to restore balance to the autonomic nervous system, activate the vagus nerve, and over time help the patient regain an incredible quality of life. To learn more about dysautonomia and how neurologically focused chiropractic care can be the missing key to drug-free relief and neurological restoration, comment below, send us a DM, or see the link in our bio to learn more.